Hi there. My name is Marcella Cox, and I am an eating disorder therapist in the San Francisco Bay Area. And I'm also the founder of Kindful Body. And I am here today with Dianna Marino, who's a registered dietitian with Kindful Body. Welcome, Dianna.
Thank you. Nice to be here.
It's nice to have you. So, Diane and I are going to be talking about when it's time to see a dietitian in your recovery, but also answering some more general questions about the role of a dietitian and what a dietitian does and what sessions look like. Well, first of all, do you want to give people who are watching just a little bit of background about yourself?
Sure. So I'm a registered dietitian nutritionist, and I've been an RD since 2013. I did my master's degree in nutrition education at Columbia University and also did my dietetic internship there as well. I've been working with eating disorders for the past 3 years in outpatient treatment centers, working with partial hospitalization and intensive outpatient patients. And I've also had a private practice where I've been seeing clients on the outpatient level of care as well.
Awesome. And we're so fortunate to have you as a part of the Kindful Body team, to know that you're a resource we can go to, as therapists, but you're also working with clients in the practice and helping clients in their recovery. So before we dive into the questions, I'm wondering if you can give just a general overview of what is a dietitian.
Yeah, sure. I think it can be really confusing when people hear the term dietitian and also nutritionist. And a lot of times people come to me with confusion about what the difference between the two of them are. So it really helps to kind of break down the differences. So a registered dietitian has to have completed a minimum of a bachelor's degree in an approved level of coursework. And for a nutritionist, there really is no minimum requirements or minimum education that they have to have completed. Dietitians also have to do a 1,200-hour supervised dietetic internship that they have to apply for and be accepted to. And this is supervised hours with working dietitians in several different areas of the field. And for a nutritionist, they really have no supervised practice hours that are required of them. We also have to pass a national examination that's held by the Commission on Dietetic Registration, whereas nutritionists have no exam or no certification process that's required of them. And then to continue maintaining our certification, we have to do 75 hours of continuing education every 5 years, as well as submit a learning plan to then do around those continuing education hours. And a nutritionist really isn't a regulated title, so they don't have any ongoing requirements in order to remain calling themselves a nutritionist. Finally, dietitians are obligated to use evidence-based research in helping their clients. And since anyone can really call themselves a nutritionist, there really is no obligation there to use approaches that have been proven to be effective. For anyone in eating disorder recovery, it's really important to work with a dietitian and specifically find one that is specializing in treating eating disorders. Eating disorder dietitians, we use approaches that can help heal the client's relationship with food, but we're also using medical nutrition therapy, which a nutritionist is not, they are not qualified to be using medical nutrition therapy, otherwise known as MNT. And we use that to help guide the patient back to health. And we're often in communication with their doctor through doing this. So it's also important to note that diet culture can often co-opt eating disorder recovery terms, such as intuitive eating. I think we've all seen that thrown around a lot. And working with someone that doesn't specialize in this field, it can really cause further harm and possibly make the behaviors around food worsen if not used properly. So we're also trained to look at the full picture of a client as well. We look at what's going on and we really become part of your treatment team. So a dietitian is trained to work with several different members of treatment teams, including doctors, therapists, the family members. And within this communication, we're trying to find the best way to approach recovery with this client and help them in the best way possible.
Well, thank you for that. Wow, that's so much information. And I think, you really clarified so well that anyone can call themselves a nutritionist and why it's so important, especially when you're in recovery. And you're trained to work with as a part of a collaborative team. And that is really, really the standard of care, right? Having a therapist, having a dietitian, possibly a psychiatrist and doctor on that team and working together to help a client in their recovery on their journey back to intuitive eating.
Absolutely. It is a team approach. So,
yeah. So when is it time to see a dietitian?
Yeah, so I think this is another good place to kind of talk about, because people can be confused about whether or not they might need a dietitian throughout their recovery journey. And I think if you're finding yourself really frustrated or confused about how to feed yourself, how to nourish yourself, that could be a good enough time to come see a dietitian and talk that through. We all live in diet culture, which makes it a lot more complicated than it should be to feed ourselves. And we are given so much misinformation, whether it's on TV, whether it's on a book, social media, an app. There's really a lot of nutrition advice out there. So dietitians can help you sort through all that information and help you feel confident again in making your own food choices and trusting yourself to do that. If you're struggling with an eating disorder or have disordered eating, a dietitian can play a really important role in helping you to recover from that, as they can provide you with an individualized meal plan. And what that meal plan can do can help normalize your eating patterns. It can help regulate your metabolism again, and also reduce your eating disorder behaviors. Dietitians can also provide nutrition education that can be helpful in understanding what your body's needs are, and also learning the science behind what goes on in your body as a result of engaging in disordered behaviors with food. Dietitians can also help guide you through the path of becoming an intuitive eater again and healing the relationship with food at the same time. So if you're engaging in disordered eating, or maybe you've had years of chronic dieting behaviors and you've gone through weight cycling, that can also be a really good time to meet with a dietitian too. It's common for us to really lose sight of what's normal when it comes to feeding ourselves, because disordered eating, sadly, is very normalized in our culture. You might know several people in your life that are dieting and doing strange things with food, and we don't really bat an eye to that anymore. So if you find yourself going through cycles of maybe restricting food and then feeling out of control around food, a dietitian can help you to find that balanced way of eating to help you prevent you from falling into those extreme behaviors, going back and forth. If you're experiencing orthorexia, and this is otherwise known as an obsession with eating foods that you consider to be healthy, a dietitian can help you come back to eating a balanced variety of foods and help you eat foods that you really enjoy again, and find that peaceful relationship with food. And then if you're not sure if you're engaging in disordered eating, or if you do have an eating disorder, that's another good time to consult with a dietitian, because it can be confusing, and we're here to help guide you through that.
Sounds like, that there are lots of places where you might consider, like if you're already seeing a therapist, adding a dietitian to your team. I love that point that you raised, that disordered eating is the common way that we're now eating, right? It's almost glorified in our culture, like, you're doing this other thing, this cleanse, right? There's lots of things that are not really necessary, and then further disrupt our natural cues and the way our bodies work.
Especially when we hear the terms like clean eating, or Whole30, or all the different fad diets that are out there that really, they glorify certain ways of eating while really shaming eating certain foods, which, if you already have an eating disorder, or you're already engaging in disordered eating, adding that to the mix can really make you feel like you're out of control with food and really need some guidance. So.
Yeah. And I think that's the key is right that piece of, the feelings around the food, right? And that they do arise when you've been told, right, that our culture is telling you like this is a bad food and therefore you're bad or if you eat the food. And can you tell me a little bit more about what sessions are like in working with a dietitian?
Yeah, sure. So when you start working with a dietitian, we will usually begin with an initial assessment. So this is really an opportunity for the dietitian to gather a lot of information about you, and some of the information will include your health history. So we'll look at your current health status, any conditions that you're currently experiencing, physical symptoms or complaints that may have arisen due to the eating behaviors. And we'll also look at your current eating behaviors and patterns and how that might have evolved over time. So I would like to figure out a little bit more about how you got here with your eating patterns. Tell me what that path has looked like for you. And then I'd really like to dive into the thoughts and beliefs around food, right? So trying to figure out why you act the way you do with your food, why you engage with food in these particular ways. So the first appointment is really an opportunity for me to ask questions and try to get the full picture of what's going on with the client. So that way I can come up with the most effective interventions to help you. I'll also usually provide the client with a meal plan from there, if that's appropriate for them, and then a clear set of realistic and attainable goals that they can begin working on right away. And then when I have follow-up sessions with a client, which is usually weekly, we'll focus on the client's goals and overcoming any barriers towards reaching them. So based on the progress that they've already made that week and where they're still struggling, the dietitian will usually guide the client appropriately. So that will include implementing the principles of intuitive eating and then also providing appropriate nutrition education where it's needed.
Oh, awesome. So it sounds like it's really kind of straightforward and direct. And how do you, I know this question is just kind of arising, but sometimes it's easier like on paper than actually implementing some of these things. Like if someone isn't doing it exactly right, like how do you work with that?
Yeah, absolutely. It's a really individualized process too. And it's hard for me to say exactly how a session will go because it's really unique based on the individual, and the goals are going to be so unique depending on what you're going through and, what kind of challenges you're facing when it comes to, having a peaceful relationship with food. So this is meant to be a journey and a process. So, after 1 week, I want to see what kind of struggles and barriers are coming up for you in reaching these goals. So I want to hear about that, and I want to help you find ways that we can work around those barriers. It's not going to be an upward journey. There's going to be dips and falls, and there's going to be struggles that come up along the way, which are to be expected. But that's why the dietitian is there to help when things get harder, and to help also acknowledge the progress you're making.
Awesome. So I really appreciate you clarifying that. The goals are individual to the person, and you are offering the support, because if it was that easy, you wouldn't need to see a dietitian, right? I'm wondering if you can tell people a little bit more about what intuitive eating is.
So I like to kind of go back to the two creators of intuitive eating, which are Evelyn Tribole and Elise Rush, who are two dietitians who came up with this framework. And it's been a research-based framework that has been proven to be effective in the treatment of eating disorders and disordered eating. So according to Evelyn, intuitive eating is an evidence-based mind-body health approach that works towards cultivating or removing obstacles to body awareness and honors health by listening and responding to the direct messages of the body in order to meet your physical and psychological needs. So this is a lot more than just listening to your hunger and fullness cues, right? I think diet culture co-opts this and uses it as the hunger and fullness diet, but it's so much more than that. Working with an eating disorder specialized dietitian is a really great trusted way that you're going to get these principles applied in the correct way to your path of healing. So the way that they're meant to be used is a few different ways that I like to use them with my clients is by helping you kind of identify what your hunger and fullness cues feel like at this point. Sometimes when you have disordered eating or you are actively in an eating disorder, we can, lose track of what hunger feels like and sometimes lose hunger cues altogether. So we can't really trust our hunger cues to even tell us when to eat, which is why, a meal plan comes into place. But coming back into our bodies and realizing that maybe we're missing our hunger cues. Maybe we've been ignoring them for so long that we don't understand what they feel like anymore. Mm-hmm. So bringing us back to that body awareness where we can identify what hunger cues feel like and identify when we've had enough food and we feel satisfied with what we've eaten is part of the journey. We can also help to look at the food beliefs that are going on and certain food rules that you might have been subconsciously following throughout your eating disorder. In looking at these, then the dietitian can provide nutrition education around, some of these beliefs we have around food and help you challenge them in those ways. Intuitive eating is also about, finding unconditional permission to eat. And we use this in our sessions by creating an all foods fit approach to nutrition. And the dietitian will help you then create a balance and understanding how to create balance in your meals, including foods that you really enjoy and foods that have nutrition value as well. So understanding how to create a satisfying meal. We might have lost track of even knowing what foods we prefer along the way of dieting and engaging in disordered behaviors. So how can we come back to figuring out our food preferences and creating a satisfying meal based on those preferences? Mm-hmm. And then lastly, when it comes to, using disordered eating behavior, sometimes we're doing that to replace coping with certain emotions. So figuring out, when is that happening and when can I use other tools to cope with my emotions instead of, turning to food or turning to restricting myself from eating food.
It sounds like a great framework. And actually, that this is the way that we're born into the world. Like intuitive eating is kind of our birthright. And I've been around a little bit longer than you, and I just, I've heard things like, avocados are bad, avocados are good, eggs are bad, eggs are good. It's just like this information that we get, and it changes over time, and we don't listen to what our bodies are saying about this food and how we feel after we eat it.
Yeah, absolutely. We start to really take all these external cues around, what we should be eating, how much we should be eating, when we should be eating. Now that there's all these fasting diets out there that tell us not to eat between certain hours. So all that information can really take us out of our bodies, and we just are missing the cues that our body is giving us all the time. So, learning how to come back to that attunement and being able to listen to your body, quiet down, understand what your body's telling you, and trusting your body too, because it's a two-way street. You have to learn to trust your body, and your body needs to learn to trust you too.
Yeah, absolutely. Good point. And there's wisdom in our bodies. Let's not forget. Last question that I have for you. You've mentioned eating disorders and disordered eating, and I'm just wondering if you could clarify, what's the difference between the two?
Yeah, absolutely. So when it comes to the difference between having an eating disorder or engaging in disordered eating, we're looking at a few different things. So to what extent is the client exhibiting behaviors around the behaviors that they're engaging with food, and also the obsession and the functionality around the food? So some questions that we might want to consider are what types of behaviors is the client engaging with involving their food or their body image, and how often are these behaviors occurring? So sometimes they could be occurring multiple times per week or even multiple times per day. Usually those struggling with an eating disorder are likely engaging in a few different behaviors, and those are usually occurring a few times per week or even per day. Those struggling with an eating disorder also tend to have thoughts that are all consuming around food. They might be so consuming that you find that they're distracting you from, doing your daily activities of life. And then if you're struggling with an eating disorder, chances are that it's causing you to be taken away from normal life functioning. And an example I like to use is, if you find yourself not wanting to go to certain social events because there will be food there, or the food makes you nervous at certain social events, that's a pretty good chance that you're struggling with an eating disorder there.
Mm-hmm, mm-hmm. Well, thanks for clarifying. And I, kind of seeing it on a continuum from disordered eating to an eating disorder can also be helpful. And seeing a dietitian could really be helpful, even if you don't have like a full-blown eating disorder. Is that right?
Yeah, absolutely. If you find yourself going from diet to diet and just kind of looking for that magical answer to, figure out how you should be eating, then, chances are that you're not trusting your body, you're not trusting yourself to know, how you should be eating yourself. And everybody has the ability to be able to do this. So working with a dietitian can really help you to come back to that and learning to trust yourself again when it comes to food choices. So yeah, I think the full spectrum, from engaging in disordered eating patterns with food to having an eating disorder, anyone can really benefit from meeting with a dietitian and, figuring out what's going on for them and how they can find a more peaceful relationship with food.
Awesome. Well, thank you so much for sharing all this information today and for your time today, Dianna. It's been so helpful and such a pleasure to discuss all this with you.
Absolutely. Thank you for having me. It was a great conversation.
Awesome. Well, it was great to spend time with you. And I just want to say, if you're watching and you're struggling with food or your body, noticing you're having a disordered eating relationship with food, we really invite you to reach out for support. The contact information is available at the end of the video. Thanks for spending time with Dianna and myself today.
Yes, thank you so much.